for Lifeline Durban. Welcome to Salam Media.
Thank you. Thank you so much for having me.
Thank you for making the time. I know you're on holiday, but when you work in the NGO space, Pravisha, it's always a working holiday. There's no such thing as switching off. Let's start there. Where does that commitment come from?
It's just the passion. I am a social worker by profession. So obviously it starts there. And so I've been in the field before going into such a position. So yeah, the passion is just there. It drives you. It's just part of you. And so it's very difficult to distinguish between, and especially with the kind of work that we do and the arena that we work in, it is difficult to create that, complete solid boundary, so to speak.
Right. I think we're very blessed in a sense that we love what we do because that's where the passion comes from. But you, of course, understand that it's been a very intense year. People are starting to wind down towards the year end. Some people are on holiday already, some are not. Some are waiting for the holidays to begin. It's also a very high stress period, Pravisha, year end, in and amongst the fact that it's, festivities, it's the end of the year, it's the holidays, people are traveling. But there's also some stress and strain and pressure around finances or the traffic or the state of the political situation in the country. What kind of advice would you give perhaps to people who are feeling under pressure and under strain right now? What can they do to help calm and center themselves? Can they reach out to Lifeline perhaps?
Definitely. Yeah, this part of the year, as much as it's termed the festive period, we do receive most of our calls and cases during this festive period. Having some not having access to money, others obviously during the December period is the bonuses. It is the year end, so they sometimes even have this extra money, and that's when we found that a lot of the abuse happens because the alcohol usage just increases tremendously. We find that that also then obviously leads to the whole issue in terms of the gender-based violence cases that we get. But in terms of that, apart from that, there's just that whole issue in terms of loneliness, depression, that also sets in during this part of the year. Somehow you'd have individuals manage through the year by themselves, but just in this period, whatever social media presents and what is happening around them suddenly starts to bring on that anxiety and loneliness. So that is also another kind of issue that we deal with quite frequently during this period. But I think the thing is that we are available, and especially our national crisis helpline, and the fact that we are available, just during the shutdown is just between Christmas and New Year. But even during those times, we are at all the hospitals and all the police stations that we stationed in. So we're available, irrespective of what the concerns are. We are that sort of outreach. You could definitely reach out, and we do have a social worker that is available to assist. It is a difficult period. It is a matter of, some of us could engage and meet with family, some cannot. That brings on another level of anxiety, a sense of sadness, a loneliness again. So there's various issues, all the way from just loneliness and relationships up to gender-based violence cases.
Right, absolutely. I mean, that gives us a very good overview of some of the issues that Lifeline Durban is dealing with over the festive period and committed to helping people navigate the space. So you highlighted gender-based violence, which of course we know there's a huge outcry about regularly in our country, as it should be, with the call being that 16 days is inadequate. We actually need 16 days, 365. But certainly Lifeline Durban is one of the stalwart organizations that lives that ethos of not only working against gender-based violence during the 16 days, but consistently throughout the year. Pravisha, give us an overview of what we are facing as a country in terms of gender-based violence and what kind of support services specifically that Lifeline Durban offers.
So with regards to gender-based violence, we definitely have an end-to-end service. And by that I mean we have approximately 65 social workers based in the areas we work in. So our areas include that of eThekwini, Then the north coast, that's Ilembe district, and the south coast, that's the Ugu district. So it's quite a vast area. In that, we are currently present in 9 government hospitals. At least 5 of them are 24/7. And then we are at 51 police stations. So our social workers that are based here provide psychosocial support services and counseling to any individual that walks through. So, for example, with the police stations, a victim of gender-based violence, sexual assault, or rape does not have to come in and report the matter at an open desk. Rather, there is a secure, safe space, a room that's made available. It's called the victim-friendly rooms in the police stations. And at the hospital, it's the Thuthuzela Care Center, which is a
Mhm.
one-stop center for GBV victims. So we're able to provide these services in terms of the counseling. That's the first point of call. And then through that, um, you know, obviously we're monitoring statistics on a monthly basis. And we're working with other organizations because it is a multidisciplinary approach. For example, at the Thuthuzela Care Centers, they're seen by us as Lifeline. Then it's the district surgeon, that's the government hospital. Then it's the National Prosecuting Authority in terms of the court processes and support through the court processes. And then it's South African Police that's also based there in terms of the victim statement. So it is really very much a holistic service that is being provided in terms of the one-stop. But in terms of Lifeline, we do not, our services in terms of gender-based violence does not just end there. Once that process is completed, we provide prevention programs. So in our prevention programs, we address schools, again, in all districts, where we go in providing the No Means No prevention program, where we are enabling young girls and boys in terms of using their voice, defense mechanisms, and other creative, innovative, preventative methods in terms of gender-based violence. So there's an entire program in terms of prevention and awareness. We do have targets in terms of that. And then that's how we reach in terms of the primary and secondary schools, as well as TVET colleges and universities. Then we
Mm.
have a skills development program. So they come through for a week or 2-week skills development program, during which we provide various skills um, the 10-day HIV/AIDS course that equips them, and it is a certified course. Then the personal growth that helps them, in terms of self-awareness, and then parts the way in terms of their personal growth, in terms of a particular skill. And then there's like detergent making, and then we've included art and yoga and all other creative methodologies in terms of the skills development workshops. Thereafter, there's an aftercare and support, during which we provide the support for court, as well as we
Mm.
provide the support in terms of support groups that we run at the hospitals and the police stations, where we bring our survivors now that have completed individual counseling, perhaps probably have gone through our skills development, and now, trying to sustain whatever was done during therapy. We offer the support groups. We provide comfort packs at the police stations, as well as the Thuthuzela Care Centers. So all in all, it is quite a holistic service in terms of prevention, then responding when the incident has happened, and then the aftercare and support that is provided.
Outstanding. I mean, it's an incredible amount of work and it's intense work. It's extremely challenging under the best circumstances, but it is certainly fulfilling. And I've, interacted with the team, and I know how your entire team is committed to the work that Lifeline Durban does. But it is a over 50-year history, right? I mean, you've achieved this incredible milestone. And I remember meeting with you earlier this year, Pravisha, and saying, how many people do you think Lifeline has reached in its history? And I'm not just talking about directly the clients that you have on your files, but indirectly, the people whose lives are affected because Lifeline helped that one person, from family to neighbors to work colleagues to the community at large. And I think you just sat with that question. It's overwhelming. It's hard to quantify. But what sort of sense do you get about the kind of impact Lifeline and Lifeline Durban in particular has had over its illustrious history?
Definitely, I recall that moment as if it happened a few minutes ago, because it completely just you had to pause because it was
Mm,
difficult to articulate and put into a number. Because, like you've mentioned, there's the direct beneficiaries and then there's the indirect beneficiaries of the families, the community. So there is always that ripple effect. And that is why that whole community awareness, the community dialogues are so important, because one individual or one committee or one organization cannot really make the change. It is where it starts, but it involves all those different levels of individual, group, and community to make a difference. And especially with gender-based violence, you know, a lot of the talks we do is encouraging the community to speak out, not walk away,
mm,
to not turn your head against this. You know, just report the matter, speak out, because that is, and through that process, we found an increase, firstly, in the number of cases that are being reported. Because there is a part of gender-based violence, there's a category within gender-based violence in terms of intimate partner violence, where there is this sexual assault, rape, and issues within a partnership, within a relationship, within a courtship, including within a marriage. And a lot of
mm,
those cases were not being reported simply because it was very difficult for an individual to report on such a matter, especially when they are in such an intimate relationship. And
mm,
we found that through our awarenesses, those numbers started to escalate and those numbers started to increase, specifically under the category of intimate partner violence. Um, so yes, definitely, numbers have increased incredibly over the past, I would say, 10 years. And, you know, even the president himself has now declared gender-based violence as a pandemic, and the fact that it is just, um, you know, in the history of the work that we've done, the issues of gender-based violence have always been there, but definitely the reporting has increased. So that
mm.
in itself talks to the awarenesses that we're doing, the campaigns, the dialogues, the road shows, those all add towards that process of the reporting.
Mm.
So yeah, so that's one of the key factors in terms of the number of cases that we are seeing.
Excellent, Pravisha. We might just take a short ad break. I do want to talk about the challenges of doing this work where there are funding constraints, and also what are the plans for next year and how can people get involved. Let's take a very quick ad break, and when we come back, we'll be together with Pravisha Dhanapalan, CEO of Lifeline Durban.
This is Salam Media.
You know, it's a wonder how kids get anything done these days. With all the distractions, when do they even get time to study? As a mother, all I can really do is make sure they have all they need to perform at their best. That's why I choose to include Sunfoil, triple refined pure sunflower oil with every meal I make. Naturally cholesterol-free and approved by the Heart and Stroke Foundation as part of a balanced eating plan. So whether I'm cooking, frying, or baking, I know every dish will be a wholesome one. Sunfoil, now we're cooking.
They say breakfast is the most important meal of the day, yet many children go to school hungry because of poverty. Penny Appeal South Africa's Breakfast Club aims to get a warm, hearty meal to underprivileged children so they can spend their day prospering in their schoolwork. Help feed a needy learner for only 5 Rand a day, or 150 Rand a month. Or visit our website www.pennyappeal.org.za or call 031 1100 573 to find out how you can donate. Penny Appeal South Africa. Small change, big difference.
Discover the Africa of your dreams and surround yourself with her spectacular beauty. Relax beneath her serene sunsets and explore wildlife at its natural best. It's where the pride of Africa comes together. The Kwantu Private Game Reserve. Get to know the Big Five or cruise on an elephant safari game drive. Interact with lion and tiger cubs and enjoy world-class halal cuisine while we pamper you during your 5-star stay. Indulge in the true African experience. For reservations reservations. Call now on 042 203 1400 or visit kwantu.co.za. The Kwantu Private Game Reserve, the place of gathering.
Gaza needs your support more than ever. Homes have been shattered and families have lost everything. With your support, our teams are delivering clean water tankers, feeding the hungry, and assisting orphans who have no one left. Let us give Gaza whatever help we can. African Muslims Agency, empowering, educating, inspiring.
Breaking stereotypes, moving boundaries, joining hands. Salam Media. Humanity sets the agenda.
Welcome back to Salam Media, your home of humanitarian journalism, with Shabnam, Palesa, Mohamed standing in on news and views. And our guest, our first guest today, Pravisha Dhanapalan, the CEO Director of Lifeline Durban. Pravisha, can you talk to us about the funding challenges? We certainly know that NGOs and NPOs in our country, and it's a consistent pattern around the world, certainly struggle with the funding needed to do as much as they'd like to do, to cover their services, to be able to cover operating costs comfortably, to expand into new projects and new services that they can offer the community and the country at large. How much of that has impacted on Lifeline and the work that it does? And how have you had to pivot in terms of your direction and offering services perhaps in a different way to the public?
So this particular year has been a challenging one. Like you've mentioned, Lifeline has just turned 55. So the core business of Lifeline has always been that of psychosocial support, emotional wellness, and the whole aspect of mental health over the years. And then over the years, it has obviously diversified in terms of gender-based violence, HIV, and working with key population. Sorry. And, you spoke about a number, and we actually did a calculation, but that was just for 2024, 2025. And the reach just for gender-based violence was 114,182. So that was just for one financial year. In terms of the funding aspect of it, this year, why has it been challenging is because at the beginning of the year, we were faced with the suspension of the USAID grant, which was a huge grant that actually covered the aspects of gender-based violence, both response and prevention, and then working with young adolescent boys and girls. So that under the concept of the DREAMS program, again, a prevention program within gender-based violence. So that definitely had an impact in terms of the areas that we covered, because funding comes in for specific geographical spaces and specific municipal districts. And then obviously with Global Fund changing its application methodologies this year and expanding, there was one organization that was responsible for different provinces, and we're very restricted in terms of the areas we work. So that also posed a challenge, and those were major international donors. I think in that process, we've been receiving funding over the past 15 years from both international funders. So definitely it has had an impact. We continue to be funded by Department of Social Development, and that helps our gender-based violence program. A lot of the funding sort of is very driven towards the specific implementation of the program, and also it kind of just looks at post funding. So it funds specific social workers, social auxiliary workers. This creates a further challenge in terms of operations and other organization and support costs and overhead costs. So there's always those challenges that emerges even with funding that is very restricted in terms of the implementation of the program. So yes, we definitely face challenges in terms of funding, but on two levels, one in terms of implementation, but the other in terms of the operations of the organization, basically keeping the doors open and the sustainability. We have learned through this process that we needed to really have a very strong strategic plan, because international funding is not as stable as it used to be.
Right. So, Pravisha, I'm very excited. I know that you've got new activities coming up at Lifeline Durban next year, and it's fantastic to see how the organization is able to pivot instead of being too worried to even think about what can we do, how can we move, what kind of difference can we make, perhaps in a different way from what we've always been doing. And that's great. It shows creativity and innovation. What can you share with us about what's coming up next year?
Yeah, no, definitely. When it comes to resilience, I feel that Lifeline just stands out in that regard because, yes, we've faced these issues previously and have come out of that. Currently, we are basically, our focal point is now that of emotional wellness and simply providing counseling at all levels, community, corporate, individual. We are in the process of launching our new Wellness Solutions Center, Lifeline Durban Wellness Solutions Center, which would be based in Morningside. However, we are going to be providing these sort of wellness solutions, both community and corporate, both on site, and we would launch a center within the offices that we've just occupied at the beginning of this year. So that's quite exciting. We haven't really changed the ethos of the work that we do, nor have we changed the mission or vision. It's just re-strategizing and reprioritizing the areas of work. Because we find that, in terms of the brand Lifeline, it's a strong brand in terms of mental health, in terms of counseling, in terms of emotional wellness. And based on that, we have reconfigured going back into communities and corporate to offer them this various products under the wellness solution pillar.
It's fantastic. We look forward to hearing more about what Lifeline Durban is busy with during the course of the year and to supporting your efforts in helping to uplift society through mind health and emotional well-being. Thank you very much, Pravisha Dhanapalan, CEO of Lifeline Durban, for joining us on Salam Media today.
Thank you, Shabnam. Thank you for this opportunity.
Most welcome. Wonderful. Off to a very positive start and sharing some important information with the public about mind health. Please stay tuned to Salam Media's YouTube or Facebook. When we come back, we're talking to Mariam Juma Karikchi about why the People's TRC matters.